Clinical Services Plan. Changes to emergency general surgery.
Emergency general surgery is one of the 9 services included in our clinical services plan. Our services are fragile and need to change. Our board met in February and decided on the next steps for emergency general surgery at Hywel Dda.
What is emergency general surgery?
Emergency general surgery is mostly for abdominal emergencies, sometimes requiring urgent action to save a patient's life. Whilst operations are sometimes needed, emergency general surgery services can also include observations, advice and other treatments or medication.
Why does emergency general surgery need to change?
The emergency general surgery service is for adults, children and young people who need emergency general surgery. Currently, emergency general surgical services for adults are provided at Glangwili, Bronglais and Withybush hospitals. Children are treated at Bronglais and Glangwili hospitals. Patients from Prince Philip are taken to Glangwili for their surgery and recovery. It is difficult to provide emergency general surgery safely at these 3 hospitals. We rely on staff who are not permanent and are known as locums, who can be less familiar with local ways of working. There are difficulties in hiring surgeons with the correct skills. We have a shortage of consultant surgeons available to cover both Glangwili and Withybush. A national clinical review recommends fewer surgical units in Wales and Hywel Dda. This would bring more expertise together in fewer sites and be more sustainable and attractive to staff.
What did the board decide?
Our board chose option A from our consultation as our future model, with the intention of moving over time to include option 155 that was suggested by members of our communities. This will mean that emergency operations will be provided from Bronglais and Glangwili hospitals. The current surgical teams from Glangwili and Withybush will join to become one big team. Under this decision, patients at Glangwili and Withybush hospitals will be able to access care through surgical same-day emergency care units. These units can support most people without the need for an operation and means people can be seen, treated and often go home the same day. Patients from Withybush Hospital who need an emergency operation will be transferred to Glangwili Hospital and return to Withybush Hospital, their home or the community when well enough to do so.
How will this benefit patients?
This aims to help address staffing pressures and improve the safety and quality of care for the most seriously ill patients. Bringing the surgical teams from Glangwili and Withybush together will mean that they can work as one team and enable staff to share skills, support each other and make the service stronger and sustainable for the future. Strengthening the surgical same-day emergency care at Glangwili Hospital and Withybush Hospital will help people get help faster.
What happens next?
Over the coming months, we will be developing our implementation plans for this service change. We will communicate with our patients and communities ahead of any changes being made. In the meantime, our patients will continue to access emergency general surgery in the same way as they currently do. We know that this change may mean that some patients will need to travel further to access care, but we are committed to continue working with our staff and communities. We want everyone to have the best care possible in the safest place.
In short,
we're organising emergency general surgery so that emergency surgery will be provided at Bronglais and Glangwili. We will establish a single, stronger surgical team. Same-day emergency care will be strengthened at Glangwili and Withybush. The sickest patients get the best care in the right place.
Visit our website to learn more. https://hduhb.nhs.wales/clinical-services-plan/